therapies in myeloma are nowadays tailored on transplant eligibility still, so we have not a specific treatment available in the clinic that you can propose to these patients. However, with the novel quadruplets, also this subgroup of patients improved its prognosis, especially when 414 is not coming with other high-risk cytogenetic alterations. So isolated T414 nowadays has a very similar outcome compared to the standard risk. We have still to make progress on the double hit patients and those with the late disruption of NSD2.